All right. Hello, everybody. So I know people are probably going to be filtering in, but we wanted to go ahead and start. I did want to mention one thing, and it's probably going to say thank you, but there's going to be no slideware during this presentation. So, but the three of us, what we wanted to do is really make this into a sort of a fireside chat. I know there's a lot of organizations in here, and they're doing a lot of great things with emerging technologies, or they're thinking about using emerging technologies. So the three of us just wanted to provide you with as much information as possible, answer any questions, and have this be really an interactive session, because there's a lot of brain power and a lot of capacity in this room. I'm going to be sort of facilitating a little bit. I know we'd like to just first introduce ourselves. So for those of you that don't know me, my name is Roman Lerman. Hello. I've been in the international development sector for about 12 years. I'm the global technology and digital lead for a group within Accenture called Accenture Development Partnerships. And what we are is a not-for-loss group within Accenture that provides the same services that Accenture provides to their commercial accounts, we provide to the international development sector. So that could be digital technology, change management, strategy, whatever the case may be. And we work with a lot of people in this room, so great to see the people that we've worked with in the past and partnered with. With that, I'll turn it over to Rick and Andrew to introduce themselves. Rick?
Hello, everybody. Everyone's okay with us not using microphone, I presume? Those of you in the back of the room, we're good? Okay. My name is Rick Shreves. I'm with Mercy Corps. I've been with Mercy Corps for about 3.5 years. And the position that I hold at the agency is I'm the Director of Emerging Technology. A small group of us, 3 of us on the Emerging Technologies team. We sit inside of the larger Technology for Development team in Mercy Corps, which sits alongside the IT team. So we sort of separate back office technology into IT versus field-facing technology, which goes into Technology for Development team, and that's where my group sits. I'm not going to tell you right now about all the stuff we've got our fingers in, but we'll get to that certainly in the next 30 or 45 minutes. Andrew.
Good afternoon. My name's Andrew Lamb, and I'm the innovation lead on the global team for a new NGO, almost different style and size of organisation perhaps to the more established big NGOs like Mercy Corps. So we'll be doing some contrasts during the session. We started, really got our start in 2014, so we've been going for about 5 years. And my role has been trying to develop out new country programs. Most of our work is about working in the field, and because we only have 40 people out there in 20 different countries or something, we don't have much sort of ERP central technologies. It's all about sort of innovating in humanitarian responses. And I can say a bit more about that when we get into it. I'm a systems engineer and got a background in NGO and disaster relief work with Redar, my first job out of university, and as the first chief executive of Engineers Without Borders, which is my second job before I joined the board.
Sounds great, thank you. So before we start, wanted to just get some responses from people in the audience. When we say emerging technology, other than AI, VR, drones, crypto, and what else is on your minds as far as emerging technology is concerned?
5G.
5G? Anything else? Or did we hit all the key points? All right. So what I wanted to do is ask a first question to sort of the panel here around, what are you guys seeing as far as traction in emerging technology? Not just from a pilot perspective, but also traction from an actual implementation in the sector perspective, because I think a lot of people have done pilots in some of these areas. Some people are thinking about doing pilots, but then there's a smaller group that actually has implemented these types of technologies at scale within the specific area that they're in. So, Ray, if I could start with you.
Yeah, the question's a bit loaded for me because of what my team does. My team actually is responsible for identifying new and emerging technologies or innovative uses of existing technologies, and then spinning up trials and proofs of concept for that tech. Once we find something that has legs, well, then we share those learnings within the agency and we hand it off to other teams who actually take things to scale. So my team per se isn't tasked with the job, the often challenging job of taking these things to scale. I'm able to live in this little sweet spot where we get to play with a lot of new tech, and the goal is simply to go out and learn. Does it work? Does it not work? Where are the pain points? Is this something we should pursue further? But in terms of what are we doing that's getting traction, now to get to the essence of Roman's question, a couple of things have borne fruit for us across the last 18 months when I've really been focused on this. The first is virtual reality. We initially implemented virtual reality in a psychosocial therapy program in Iraq. The target audience there was Syrian adolescents, refugee populations largely. Basically, what we did is we looked at what was happening in VR research in the medical field. We had seen in the Lancet and some other places that people were getting traction using VR for PTSD treatments. I reached out to a VR practitioner in Seattle and had a conversation with them saying, has anyone done this with adolescents or kids? And they said, no, that's actually green field work. And so we met with our country director in Syria, said, is this something that your protection people feel comfortable about us taking on? And we found a program where there was an existing psychologist on staff, there was an existing set of psychosocial therapies already in place, and then we added into that program the virtual reality component. And the numbers that came back just blew us away. I mean, literally, it was one of those things where we got the first numbers back, and I'm like, these cannot be right. I need better metrics than this. And so we literally slowed down, redesigned the M&E markers on it, set up A/B testings and better control groups, and ran it all again, and got great numbers. So we're now to a point where we're feeling quite comfortable with it. We have expanded the program twice on the demand of the local partners that we're working with there and our local field team. As a result of one country team seeing us get traction with this technology in a different country, other country teams have now started asking questions, and the Jordan team has also implemented a program that's not identical, but leverages the fact that we had a good experience with the VR, working with at-risk populations. And so it's starting to take off a bit around the agency. That was a pleasant surprise because that was one of those things where I thought it was really a long shot and it just went. Second, we work in the Zatari refugee camp in Jordan. Most of you know that camp, large camp, has a large number of children that have accessibility issues. A high percentage of the number of kids that are in the refugee camps have some sort of physical challenge. We had a group of craftsmen there who were actually refugees as well that literally set up a workshop with a donation from a very small donor that was willing to support this. And they started hand fabricating accessibility technologies for the kids in the camp. Just sort of a startup thing, totally on their own initiative. These guys were literally dumpster diving for parts that they could grind down, repurpose, and make stuff for the kids. Super inspirational. And they actually won an award inside Mercy Corps for innovation. And I thought, I wonder what they could do if we put an industrial-grade 3D printer in their hands. And so we funded putting in a 3D printer, putting in the training, the software, everything, and they just took to it and started creating more complex pieces, taking some of these designs that they currently were hand fabbing and instead using the printer to fab them and getting good results from those. And my initial goal was that somewhere down the line, a year, 2 years down the line, they would actually start looking at doing basic prosthetic fabrication, because there are some open source, libraries with prosthetic designs and stuff out there. But the trick there is working with medical professionals for the fittings. The fittings is what's difficult. And about 3 weeks ago, I get an email from the program lead with a photo attached saying, what do you think of this? And they just finished printing their first prototype hand for a child who had lost all their fingers and part of their palm. And they had prototyped it so they could figure out the cabling and all the connections. And then just 2 or 3 days ago, before I arrived here, I received a video of them testing the first production model of that hand, picking up and dropping objects, and I'm just blown away that they've taken to it so quickly. And it just really opened my eyes to the possibility of that tech, and this is something that Andrew can talk about a lot, so I'm going to shut up about 3D printing. We've also done multiple drones trials and have found drones to underperform for us for a variety of reasons. I'm happy to have that conversation in a bit. We have also performed satellite imagery trials. We have found satellite imagery problematic at the agency for a variety of reasons. I'm happy to talk about that further if anybody wants. The other trial that we're doing right now that does have traction is using cryptocurrencies for cash transfer programming. And there specifically what we've tried is a very narrow use application where we're using a crypto token that does not have a secondary market value as an electronic voucher. So by using a token that has no secondary market value, we avoid the volatility and the speculation problems. And we use a voucher approach to this closed loop voucher system. So it has all of the advantages of a normal voucher program, plus it has the improved audit trails and M&E that you get out of the blockchain back end on it, and the reduced costs for moving the coins. That's actually worked out quite well for us. We're spinning up a second trial along similar lines right now to test a different technology stack, but it's something that we feel quite positive about and we intend on expanding the agency. We also have our very first, you wanted things that have been in production, so This isn't there. I'll stop.
Okay. So I think that was a really good transition, Andrew. And do you want to talk a little bit more about the humanitarian sector perhaps and some of the work that you've been doing in 3D printing?
Yeah. I mean, I think, is everybody here roughly familiar with 3D printing? It's basically squeezing like plastic or sintering powders to make solid objects. The point is you can almost forget about economies of scale. So if you're looking to mass produce, don't use it. And replace that with economies of scope. So where we have found success, where we found traction in 3D printing is making a very large range of different items, basically spare parts, where you can customize things to the individual prosthetics, but also small implements that are perhaps difficult to get through traditional supply chains, the kind of things that don't come in your standard humanitarian sector kit. So there's a whole range of medical implements that might be needed, or even sort of specialist tools that you can print out that you may not be able to find on local markets easily, that you may not be able to find in the standard aid sector kits easily. I think in terms of what has traction and the way the humanitarian sector works, we ignore what has traction in the countries where we work at our peril. Like here in Puerto Rico, as you may have seen on some of the Response Innovation Lab literature that's around the venue this week, here in Puerto Rico alone, there's I think 10 or 15 different maker spaces that with almost 3D printing as an archetype, as a sort of placeholder technology for a whole series of digital fabrication technologies and local manufacturing technologies. You know, all over the world, people have been manufacturing things locally for generations, way before the Industrial Revolution began to scale up production and centralize production. Everyone was making things for themselves, and you know, some of our work, some of the work I'm most excited by is simple things like manufacturing soap. Why on earth are we shipping soap around the world? I've spoken with factory owners in Vanuatu who had their soap making factory closed down, not because of Cyclone Pan, but because of the response to Cyclone Pan, where free soap was given out by aid agencies, and the market was destroyed. So now Vanuatu as a country is dependent on imports of soap through globalized supply chains, which can be easily disrupted. In the same country, we were using traditional techniques for weaving together palm tree leaves to make privacy screens. For evacuation centers, privacy is a big issue. So we kind of ignore those localized techniques at our peril in the sector, I think, and there often just aren't item codes for those in procurement systems. The advantage of all the maker spaces here in Puerto Rico, but I think we have mapped about, with some of our team in the Philippines, we've mapped 40 or 50 fab labs across islands all across the Philippines. There are 8 fab labs, fabrication laboratories across Bangladesh, and we're working with 2 of them in response to the Rohingya crisis. The countries which are vulnerable to disaster often have these makerspaces springing up with all sorts of digital fabrication technologies and the traditional manufacturing techniques and 3D printing all in the same room or able to happen in the same room. And a lot of our work is about trying to bring some of that support into the humanitarian sector. I think the maker movement that has all these maker spaces and fab labs around the world is often looking for social impact, social purpose. They know when they're making things in these spaces that it has a broader meaning, that it could have bigger potential in the world, but they haven't quite found it yet. And so bringing those emerging technologies which are already existing in developing countries in with what I would describe as the globalized supply chain infrastructure of the aid sector, there's some real potential to leapfrog economic development, increase resilience, as well as doing supply chains cheaper, better, faster.
Thank you, Andrew. I'm just going to give one example, and what I want to do is actually go out into the audience and see what some areas are that you are working on that has traction, because I think that would be beneficial for the group. And then what I want to do after that is talk a little bit about barriers and challenges in either piloting or implementing emerging technologies. So some things that we've all seen, that we've all experienced. So from the Accenture Development Partnerships perspective, we work with our clients based on an issue that they have. So the one example that I wanted to use is an Indian NGO that provides meals for 2 states in India. And the reason I'm using this example is because it combines 3 emerging techs in one. So we talked a little bit about specific, like a drone project or a VR project or 3D printing project. So this combines blockchain, machine learning, and IoT as an example. And this is something that's been implemented. Doesn't mean there's a lot of traction in these types of projects all over the world, but I at least wanted to use that one example. So what does this NGO do? They provide food for children. So they provide meals. And it's sort of like a food bank, but more than that. And their challenge was there was a lot of waste. There was a lot of inefficiency within the supply chain, but also how many meals do you actually make? And so how did they become more efficient with the limited amount of dollars that they have? So we worked with them to basically implement blockchain, implement machine learning and IoT. And at the end of it, what basically happened is it's to predict meals. How much food do you need to bring in? How many meals should you make that particular day? That's the machine learning aspect of it. Based on algorithms that we created with them, based upon some historical data that they have, and also research that we did with them as well. And then we used IoT sensors as well. So IoT sensors for things like what's the optimal temperature to cook at? And so that's like one example, and there's other examples as well around how to become more efficient in actually preparing the meals using those types of sensors. So that's actually an implementation, it's being used, and the outcome of all that is that they exponentially can feed more children with less waste. So that's one example I wanted to give that sort of combines 3 emerging technologies in one, and that's actually not a pilot, it's actually an implementation. The other example I wanted to use is something that we work with a lot of our clients on, which is you don't necessarily have to do everything yourself, right? Go out and find partners that do it better or that you can leverage. You mentioned a little bit of something like that. So I can't mention the client name, but there's a client in Africa that basically worked in deforestation, in CO2, that sort of space. And they wanted a way to basically better predict hotspots for dangerous gases. And so we said, look, don't try to figure out how to do satellite imagery. Don't figure out how to do all these other things, right? Go figure out who you can work with, partner with them. And the reason I'm using that example is because they're actually partnering with NASA to get satellite imagery and to get sensor data from those satellites around gases in certain parts of the world. So the reason I'm using that example is you don't, as an NGO, you don't necessarily have to, have experts in one specific area, but look at who has those experts and if you can partner with them and be creative. basically the point of that whole story was be creative, right? The NASAs of the world, it may not seem like a logical choice, but they have that data, they have that information, and you may be able to get the data that you need or the technology that you need to then implement that and in your overall solution. That specific example is not in full implementation. The solution is currently being developed and will be implemented hopefully by the end of this year, but definitely first quarter of next year.
Just on that point, if you've not reached out to NASA, NASA is super user-friendly. They do a fair amount of work with us as well, have a really great, healthy relationship with them, and unlike a lot of what you would associate as government agencies, they move very quickly. And so actually keeping up with them is a bit of a challenge, but they're definitely worth reaching out to.
Yeah, I found that experience as well. We all know how working with governments or government agencies can be, and that was a really refreshing surprise.
Yeah, exactly.
Yeah. So what I wanted to do is throw it out to you guys, right? Don't be shy. We're all friends here. In the NGO sector, it's all relationship-based. We're all friends. So any really cool, innovative items around emerging technology that either you have done or heard of or thinking of doing that you want to share with the group that can inspire others and give them ideas? Yes, please. Can you state your name? Stand up, state your name.
Me?
Yeah.
Yeah. I'm Krista Lincoln from Danish Church Aid. My example is from Cambodia, where we developed an app combining weather data, location data, and soil types to advise farmers about what to do next in the agricultural process, also based on agricultural knowledge. So like, okay, it's raining now and you are in this area, you have to plant your seeds and don't wait a day. So very basic information to go out and very useful.
How many farmers are using that system?
That's part of the challenge because it's app-based and smartphones are used, but not so widely used. So, but I think a few thousand at this stage.
Nice.
Anybody else want to share? Yep, sorry, please. Stand up, state your name.
Sure. My name is Deepak Puri. I'm with Democracy Labs. The project that we were involved with this is in the US. There's an organization called Abortion Care Network. And the problem they were trying to solve is as more and more states shut down clinics, it was getting harder and harder for women to find out what is the nearest clinic. And sometimes it's out of state. So what we did was our first crack at this was using ArcGIS, where we had a searchable map. But then we got a little smarter at it, where we created a chatbot. The chatbot, we used Twilio, and what happens is you can type in your zip code into an SMS, and then the chatbot does proximity search. And for those of you who are not familiar with it, you can't, like I didn't know this myself, you can't just search for the closest zip code. It doesn't work that way because the nearest clinic might be in the next state and the zip code there is totally random. So then we came across this company called Algolia. It's spelled Algolia, and they actually have a free version. So what happens is, this is the sequence. The person looking for the clinic types in his or her zip code. The bot takes the zip code, feeds it into Algolia, and in Algolia, we have details of all the 100 clinics that are out there. Algolia is smart enough to figure out that to this zip code, these are the closest 3, and then the bot basically sends it back. We just like these products, Twilio, ArcGIS, and Algolia. Thanks.
Thank you for sharing. Anyone else? Yes, please.
I'm Frederick Winsness with Metal. And just a question for the group. Has anyone here used 3D printing for surgical or medical equipment? You have. I'm not going to mention the member, but it was part of one of the dream sessions we had where they have mobile, they go from village to village and carry a lot of surgical equipment.
Yeah.
And to sterilize them and deal with all the cleaning and such is a nightmare. So one of the dreams was to say, okay, why don't we just get a barrel of plastic and keep printing these things out, and then recycle them in more or less in place. Is that, I mean, is it viable? Is it?
Yeah. I mean, there's yeah, it's viable. It's in some places like Gaza, it's routine. It's viable from a technology point of view. From a procurement point of view, it depends. It depends where your money's coming from. It depends where your procurement team are. One of the big challenges Field Ready has had when it comes to printing even just basic surgical implements, let alone sort of diagnostic. One of our partners, a great organization that does the work in Gaza called GLIA, they've done stethoscopes and pulse oximeters and all sorts, really interesting, and tourniquets and things, and often using 3D printing and then 3D printing molds to go on small scale injection molding machines to up the production rate. You can, crank the handle and out comes you've got your barrel of plastic pellets and you heat it up and you squirt it into a mold and there's your medical implement. It's the kind of thing you can carry in a suitcase. That becomes problematic with procurement departments because of regulation, basically, that even though it may well be filling a need, some of the places that we were working in, the Himalayas, Sindhupalchak district in Nepal after the earthquakes there in 2015, they didn't have these medical implements, basic medical implements, and the only way they would get them up into the clinics in the mountains was basically one of the nurses would have to go to Kathmandu with a backpack, stock up from the medical supply division and go back again. But when the American Red Cross, we started working with them because they were really interested in applying that technology, the problem was FDA approval. That these devices which are being made, and that will, by the way, become the way things are made, I think in the future, distributed, decentralized fabrication. It's very hard to regulate the quality of that. So even though it is better than perhaps the nurses having to use pliers from a random toolbox that they can find as a pair of tweezers, which definitely not FDA regulated. The American Red Cross couldn't procure from Field Ready, from the companies that we set up in Nepal to do 3D printing work, because the processes weren't FDA approved. So technologically it's fine. From a regulatory point of view, it becomes really difficult for procurement teams to procure it. And I think that's probably a bigger area. The amazing thing that GLIA has done in Gaza with its medical devices is that it has this rather small NGO that's headed by some medical doctors. They got a Health Canada license as a medical manufacturer and can re-grant that to others in the field, so they get around some of those procurement problems. So yes, it's possible, and it depends on your procurement processes. But and it's, by the way, also possible to do it in a regulated way, which just isn't very well established yet.
Just as a quick follow-up. So, I suppose it's easy to dismiss the regulatory piece, except that you wouldn't accept that for pharmaceuticals or anything like that.
Well,
so
you shouldn't accept it for diagnostic devices. A 3D.
So I guess my question is practical in that sense.
Yeah.
How do you ensure quality control in the systems that you're using? So I'm sure there must be processes for discovering imperfections in the molds and things like that. And I guess the second part is that you mentioned recycling. Do you deal with the waste? I mean, do you actually since it's made with injection molding plastic? I mean, are you disposing of it?
Okay. On the recycling point, I wouldn't bother. Honestly, recycling plastic is something that's best done at scale, and I'm nervous about any sort of small-scale recycling technology. We've tried precious plastics, we've tried commercial machines in the field, And we've engaged with Plan Australia, who've done similar things with universities in Australia working in Solomon Islands on plastic recycling. In fact, we're even part of a field plastic recycling group under something called the Internet of Production Alliance. And it's just, at the moment, it just isn't worth it. You can reuse, because the recycling technology is unreliable. The problem is if you're recycling for 3D printing, you need a very good quality plastic, because if you've got a bubble or a bit of grit in there, you block your 3D printer, and it's just not worth using. What you can do is use the same plastic to then make other things. So we're interested in non-3D printing plastic recycling sort of thing. And injection molding would be a good way to go. But again, you have to think about the sort of engineering professionalism around it, with dealing with the fumes and the energy costs involved and things like that. You've got to take a view of whether it really is cheaper, better, faster to do it that way. I'm dubious about it. And I think there are plastic recycling technologies coming through. We're investing in something called polyfloss, which is basically like a candy floss maker, but you drop plastic into it instead of sugar. What do you call it in America? Cotton candy?
Yeah.
Sorry. And basically you drop plastic in it, and it makes this sort of foam material. We demonstrated this at different headquarters once. And they loved it, but they didn't want to take a risk on it. So.
Well, I think
We're
that's a
all fixed
really,
that.
really good transition, though, right?
It's a
Talk
good
about
transition.
Barriers and
can I ask
challenges
the quality,
after that. Yeah,
the
absolutely.
quality control point?
Yeah, absolutely.
The future of distributed manufacturing depends on whether we can do distributed quality control. The way Field Ready does it is we have to have engineers that we trust in the field providing oversight, because the computer vision approaches to watch what's coming out of a 3D printer, or the internal tracking systems, they just aren't there yet. You have to have people in the field. Happily, in many developing countries, you have people who are, young people often, makes me feel very old, but like 23-year-olds who know how to use 3D printers back to front, and there are quality control. Not everywhere.
Thank you, Andrew. So I kind of wanted to transition a little bit, which is around barriers and challenges in emerging tech. So, Rick, since you at Mercy pretty much have done pilots in almost all the emerging tech areas, could you speak a little bit more around some of the challenges you found, either specifically for each type of emerging tech or in general?
Yeah, and I'll keep this brief. Really, you can dump the challenges into two buckets. Number one, finding a donor who's willing to allow you to spend money on unproven or experimental technologies, right? I mean, donors just really typically don't want to hear that you spend their money on something that's unproven. Why didn't you choose something that was proven, that we have a track record of generating impact numbers for? So having that sympathetic donor is problem number one. I know in our case at Mercy Corps, my team has a very sympathetic donor by the name of Cisco, who funds a lot of the stuff that I do. We do also, once we get things past that initial stage, we are able to tap into other sources of funding, unrestricted funding, and oftentimes piggyback on other programs once they see it up and running. But that very first initial trial, really hard to fund from a traditional donor source. The second problem is expertise. That big long list of items that I gave you that I work with, I'm not an expert in all those things. Heck, I'm not an expert actually in any of those things. The only way that we're able to do those things is through partnership. So, for example, on the blockchain side of things, we work quite closely with ADP, with one of your coworkers. And for things like the VR program, we worked with a group out of Seattle called Virtual Therapeutics. On the 3D printing, I spent some time picking Andrew's brain and some others as well. So that ability to access that sort of expertise in emerging tech areas is absolutely critical. Our sector really is challenged when it comes to trying to hire those kind of people, because most of those people, first off, they're few and far between, and second, they're likely to be working for a startup or a very tech-focused company that has the sort of culture that would attract them and be more tempting to them.
With you on the donors, I think I basically spend a great deal of time applying to innovation funds, and what I see is that, to be quite open about it, I see government donors being really interested in innovation and wanting to bring it into the sector. But they can't afford to manage it and take the risk themselves, so they do it wholesale. So they give a fund to some fund manager to then manage a fund, and then that gets often subcontracted out again, or you have various committees making decisions. And in some cases, I've ended up sort of trying to explain to interns for big management consultancies what on earth humanitarianism is, and what the aid sector is, and no, you will not be able to do due diligence visits in Syria easily. And basically, there are so many levels of contracting involved that it just becomes a regular project. And what they want by the end of it is sort of risk-free innovation. They want something that just they know is going to work and is going to tick all the boxes all the way up the contracting chain. So I'm afraid innovation funding has become really difficult. I've been extraordinarily lucky that with a major donor through the Shuttleworth Foundation. So Mark Shuttleworth has a foundation, and they have a series of fellowships that they offer. Applications are open at the moment, folks, if you want to apply. And it's worth up to about $1 million over 3 years. And that has allowed me to have that really flexible funding to seed fund experiments in blockchain and mapping approaches to map manufacturers all over the world, so that we know what manufacturers. The aid sector maps capabilities very rarely. They map needs and they map vulnerabilities. Field Ready, we invest in mapping capabilities, not vulnerabilities, and doing trials like that so we can bring combinations of technology together. Regulation is a challenge, expertise is a challenge. I would also suggest that engaging with the aid sector, trying to create Field Ready exists because we want to try and pioneer innovations in the aid sector to make them field ready for the field, and to help other aid agencies to adopt them, like Mercy Corps, like UNICEF, like Oxfam, World Vision, who we've worked with in a big way. And at some point, we may feel like it's a bit of a tick box exercise because the donor said we need some innovation in this program. But at some point, also, you end up having to talk to the procurement department for what we're doing, and that can be very hard to change.
Thank you, Andrew. So I agree with both Rick and Andrew. I just want to add a couple things from my perspective, working with a lot of NGOs across the world. 3 things. One is be very, very tactical on what issue you're really trying to solve. And don't just do emerging tech for the sake of doing emerging tech because it's cool, or you want to get your name out there from a marketing perspective, or you want to say, hey, we're doing this really cool thing. Like really, really focus in on what's that one issue that you really want to try to solve. I mean, we all know that limited funds, limited time, limited budget, limited amount of people that have multiple jobs that they need to do at the organization. So really be tactical on, let's just focus on one thing and really put our efforts to that, and what's the issue that we're really trying to solve with that emerging tech. That's one sort of challenge that I've seen working with some of our clients that say, hey, we want to do something, in emerging tech. The other thing is really, really focus on building an internal business case. So a lot of times, you don't have that buy-in from the C-suite or the board of directors or your ED or some of your core donors. But if you really spend some time really thinking about what is that internal business case for that issue that you're trying to solve, it becomes a much easier sales job, is what we've seen. And it's, whether you ask a third party like ADP to help you or you do it yourselves, really, really spending that time on the front end will pay dividends on the back end. The third area that we've seen is, in order to do these projects successfully, even in a pilot stage perspective, you really need to have a mind shift to be more like service design orientated. You can't really go in doing these types of emerging tech projects with the same sort of waterfall mentality of implementation, the way you've done, system, ERP, back office type of projects. They will not be successful, even at the pilot stage, or you'll be spending a lot of time, money, and effort with limited results. So really focus within your organization, and how do you change that mindset from top down into being more of in a service design mentality, because all these emerging technologies require that sort of mentality in order to really be successful in the future. So I just wanted to add those 3 things from my perspective, working with many of you here and others. With that, we have a little bit of time left, and we really wanted to open it up for questions about anything. Before I do that, I know someone screamed out, and I apologize, I didn't see who. What about 5G? So in 30 seconds or less for the panel, I'll start. we have not had any conversations with any of our clients around 5G in the developing world. The reason is because it's not really there yet. So, our conversations are more around how do we use SMS for this specific issue, or can we use 3G or 4G, and how do we do that, or how do we use white space, right? So everything but 5G, because it's basically not being deployed, from my experience, out in some of the camps and fields, unless there's a specific use case with a large funder and a telecom company that wants to provide it, build a tower, or whatever the case may be. It becomes a much more difficult conversation. That's at least from my experience. I wanted to ask you guys from your experience of 5G in the field.
One of the items that was on the to-do list for this fiscal year from my boss for me was to figure out how much of the hype around the increase in connectivity is legit and how much of it is just hype, and to figure out where the opportunity lies. That's an open question for us at this point in time. It's something we're trying to dig in and figure out where there's need.
Have you done anything with 5G?
No experience. My view is that it will, because of the range involved in 5G, it will transform manufacturing by bringing some of the Industry 4.0 stuff along much faster, and transform supply chain, warehouse management, things like that in the aid sector. I think it's much more likely to be useful inside organizations than perhaps in programs.
Great. Thank you both. So we want to leave a little bit of time for any questions you may have, and anything that we spoke about, or any of the other technologies, example challenges.
So I just wanted you to touch on the drone project that you worked on.
Yeah, we use drones in a couple of different places, really focused on agricultural use cases, whether it's yield prediction or detecting things like broadleaf pests, also a little bit on the M&E side of things. What we found in general was that it tended to be hard for us to use for 3 reasons. Reason number 1, the battery life on drones just isn't that good. Reason number 2, having trained pilots is an ongoing struggle. And reason number 3, in a lot of the places where we work, where there are regulatory environments, the regulatory environments have simply pulled a page from the commercial pilots sections and applied it to drones, making the regulatory environment very challenging. So we love the idea, but we struggle with it, and it's underperforming as a result.
We see that it's got big potential. Like, we did a study for the World Bank on Lake Victoria about they're thinking of having a drone port in Wanza, and the idea was, well, a drone would go to a clinic, pick up a spare part that needs to be replaced, fly it back. Next to the drone port, there would be a makerspace. We'd make the spare part rather than shipping it in from Dar es Salaam or something, or from wherever it's made, Germany, US, and then send it back again. And we did some cost-benefit analysis on that. It had big potential. What I'm worried about in the aid sector is that it may not be used appropriately, and that it may be used as an extension of the existing supply chains, where literally, like, aid that could be made locally is flown over the heads of all of the people that could be making it, and it could reinforce the negative effects of globalization on developing country economies.
From ADP, we've only worked with 2 clients around drone projects. We've had a lot of discussions, and we've had some pilots. One of the examples that we used was a Nordics NGO, where they wanted to use drones to help with elder care. And it was a very niche, specific point that they wanted to use drone and drone data for. So the lessons learned around that project is many of the things that were said here, but it's using drones in whether it's humanitarian or other areas. There's a lot of current challenges, both from a mechanics perspective or actual drone, like batteries, but also, like mentioned, airspace, and every country has its own rules on airspace and what you can't do. So it's not completely ready for prime time based on our experience working with our NGO clients. And so really focusing on a narrow sliver or a specific point that you want to, a data point that you want to use the drones for, might be an easier option in a country that has looser rules around drones as your use case. And then think about maybe more on the standpoint of, how do you get the data from the drones or other parties, or can you get that data, right, in another way? And is drones really the only way that you can do that? Next question, yes, back there.
One more question.
Yeah.
You're over time.
Yeah, so,
Sorry. So, three things, I guess, very quickly. On drones, I don't know if you've looked at Zipline, but if people haven't, based in Rwanda for blood delivery, actually is probably the best use case I've ever seen
Yeah,
for drone, and probably
for sure.
the only one I actually believe in. That one's actually quite well integrated and exceptionally well done, and actually relatively cost effective for what they're trying to solve. So I think it's actually a really compelling use case.
Yeah.
On 5G, I would the best use cases for those, we're looking at sort of intersection tech. Sorry, I'm Kate Wilson at Dial. The best intersection I've seen is actually around ed tech and telemedicine, because then you're going to have enough significant connectivity at a capital city in the developing world that you'll most of the people we've been talking to as we've been looking at emerging tech have sort of focused on that. I want to go back to your project question earlier. And also open this up to people in the room. We're forward funded to invest in sort of making what are routine data projects or routine projects sort of turnkey in this sector and sort of test some of the innovation. So we invest in doing some of this. A lot of the work that we've been doing has actually been around data for development. So we partner with projects that are actually have significant data, and then we bring in both systems integrators, some of the data scientists, and actually invest dollars. So we're not asking you for money, and you don't have to apply for things. We're looking for projects. We've run a number of these across. We're in our 5th country, basically trying to figure out how to make these routine and replicable. And so if people are looking for people on data for development, we're working directly with mobile network operators. So we're actually pulling 5 to 7 data elements really out of the CDR. We're starting now for tech companies to begin to overlay geospatial and other on top of that. So you basically can create basically a layer cake of data to show how basic analytics could actually answer some of the questions that today we're doing through routine surveys and very expensive field collection methods we can actually do without ever leaving an office.
oh, that's great, thank you. We are, last one or out of time?
You're getting the hook.
Okay, I'm getting the hook. All right, thank you everybody for your time. Hope you got something out of it. If you have any questions for any of us, please feel free to